For our cover story tonight, we keep the focus on the Wuhan virus. For the past 2 days, we have been reporting the rise in the caseload. Well, today, we have figures that will make you reach out for your masks once again. The cases in India have more than doubled. Testing has been scaled up. Governments are on high alert. What's more, the markets have also crashed today. Clearly, this new variant of the Wuhan virus, called the JN.1, has become a major cause of concern. And the World Health Organization agrees it has classified it as a variant of interest. Currently, there are 2,311 active cases in India, COVID cases. In the last 24 hours, 341 new cases have been reported from across the country. In the southern Indian city of Bengaluru, one person has reportedly died due to this new variant. Here's what we know about the new strain of the Wuhan virus. It was initially identified in Europe's Luxembourg, then in England, Iceland, France, the United States and China. It is a descendant of the Pirola variant, which has its origins in the Omicron subvariant. In India, the first case of the JN.1 was detected on December the 8th in Kerala. The symptoms of JN.1 are generally mild to moderate. They may include fever, a runny nose, sore throat and headaches. Most patients also experience mild upper respiratory symptoms, symptoms that typically improve within the 4 to 5 days. A sudden loss of appetite coupled with other formerly known COVID-19 symptoms has been highlighted as a potential indication of JN.1. In certain rare cases, the JN.1 variant may also lead to gastrointestinal problems, leading to alterations in digestive health. In short, some of the most basic tasks may feel draining. If you have these symptoms, seek medical help immediately. According to the US Centers for Disease Control and Prevention, the surge in JN.1 cases suggests that it may be more transmissible when compared to other COVID-19 strains. The Indian government is concerned. Indian Health Minister Dr. Mansukh Mandavia held a high-level meeting today. He stressed on the importance of being prepared, alert, instead of living with fear and panic. The Indian Health Minister urged states to ensure preventive measures are taken, ahead of winter festivities especially. He says, and I quote, "There should be no laxity in our preparation. Health is not an area for any kind of politics." But the question is this new COVID variant life-threatening? Experts say it is too soon to say. Preliminary findings indicate that the JN.1 may not be more severe than earlier variations of the Wuhan virus. But more research is needed in order to fully understand the behavior of this new virus variant. Monitoring its transmissibility as well as its impact on immunity is therefore the key. And that's what the Indian government is focusing on as of now. Here are some steps that the government has ordered states to take. Number one, to strengthen surveillance systems for whole genome sequencing of positive cases. This will help detect newer variants on time. Number two, ramp up testing. Number three, remain alert to ensure there is adequate stock of medicines, oxygen cylinders, ventilators, etc. Number four, mock drills so that governments can assess the functionality of medical equipment. Number five, and this is important, raise awareness to counter fake news and mitigate panic. So while the government monitors the situation, here's what you can do. First and foremost, start wearing masks again, especially in very crowded areas. You might want to go back to the habit of washing your hands frequently. Vulnerable individuals should take extra precautions, seeing as they are at a higher risk. Pirola, the variant behind the recent uptick in hospitalizations, has already spread to 38 countries, including India. The WHO has already assured the public that current vaccines remain effective against the JN.1 and all other COVID variants. The US CDC has further supported this. It says that there is no evidence to suggest that an increased risk to health from JN.1 has been seen so far. This compared to other circulating variants. The bottom line is that the severity of this COVID variant may vary and it may depend on a number of factors not in your hand. But what is in your hand is the power to stay informed, to stay alert, and to follow the guidelines provided by authorities. As the festive season approaches, remember to protect yourself and others. WION World is now available in your country. Download the app now and get all the news updates on the move.